Good afternoon, everyone. My name is Nkululeko Mhlaba. I am the Managing Director of Phungela. Today, I will be pitching one of our solutions. We call it MediFor. Digitalizing health improves the overall quality in many ways. E-digital health care is an intersection between technology and healthcare. Imagine solving a country's 4 biggest health challenges within the health sector in one app. South Africa's healthcare sector has got 4 challenges. The first one, we've got doctor shortages. So in Europe, it's lower, but in Africa mostly, it's higher. So you'll find that one doctor is servicing 1,000 people. Secondly, the waiting times. When you go to a public hospital or primary healthcare center, it's a whole day event before you even see a doctor. If you're in a clinic, it might be in the afternoon. If you're in a hospital, it might be later on in the evening or the following day. We've got high medical negligence because there's no data or information that is captured on what happened. We were discussing it with the lady from Nokia with regards to say that if you intermove within the same county or province and you visit another hospital, you cannot be assisted because there's no medical data that is available for you. So the healthcare professional who is treating you needs to first understand what other medical conditions you have before they actually deal with the one that you do have. And then, which then results in high claims where people say, I've not been treated well, and they take the government to court and they're given a big settlement. And lastly, the availability of data. I remember at one point, because we are in a SADC region, other countries come to South Africa for healthcare. And someone was asking in Parliament, the Minister of Health, how many foreign nationals are we assisting in our hospitals? And he could not answer that question because there's no data. Everything is paper-based. So MediFor is there to solve all these 4 challenges. South Africa is a very low doctor-patient rate, as I've said, 0.8 to 1,000 versus 3 to 1,000 in Europe, which affects the quality of healthcare provided. Such a tool would radicalize and improve the healthcare system. This is just an introduction of who we are. We're a business technology and digital transformation firm. We provide digital solutions using software and technology. Our service offering as a company is focused on 3 things. We provide strategy, starting with digital transformation strategy, digital marketing, and ICT policy. We provide consulting services, IT project management and implementation, and IT audits and IT governance. And lastly, we build technology, software, cybersecurity, digital platforms, applications, and tech support. So that's what we do. MediFor is a web-based application that stores all the medical records of the patient in the cloud to be accessed at any healthcare facility in South Africa linked to a patient's social security number. South African public healthcare system uses paper-based medical files which sometimes get lost or damaged and mostly do not have all the necessary historical information, leading to a less quality of health. The goal is the escalation of the implementation of the National Health Insurance System in South Africa and an e-hospital where healthcare is driven by technology. The project duration is 3 years, 36 months, looking at research, app development, partner agreements. The project plan was to roll it out in 40 provincial hospitals and 350 primary healthcare centers in and around South Africa, so that we can get an adoption model. I didn't include our enterprise architecture there on recommendation of the team that I'm just going to present the app. So this is our project team, Dr. Jairam, Dr. Taza, Dr. Lutuli, and Dr. Mtangai. And some of our partners are Oracle, Microsoft, GovTech, which is the South African State Information Technology Agency, and the University of South Africa. Our potential partners are e-health tech, research, universities, software, and app developers, and particularly artificial intelligence. Now, the key aspect of our innovation is that Once we have that data, we want to be able to use AI to assist the primary healthcare practitioners to get information. Secondly, we want that information within the AI system to assist them in terms of the clinical information and decision making. So we want, when the patient works in, the data that is being captured, maybe the doctor is a bit old and has been serving 1,000 people or 2,000 people and might forget to ask certain questions. So we want the system to be able to prompt the doctor and say, in this area, this is what is happening. And through that data, it will be able to inform the government or whoever is allocating resources. For instance, I'll give an example. In South Africa, we don't have a federal system. We've got a provincial system. So each and every health department, we've got 9 provinces. They've got their own system that they're using. So if you are a patient that is in KwaZulu-Natal, another province, and you go and have a chronic medication that you take, and then you visit Cape Town, which is in the Western Cape. Now, this department has provisioned for you medication to say every month on the 5th you are coming to pick up your chronic medication. Now you go and visit Cape Town, and you don't go and pick it up in KZN for 1 month, you pick it up in Cape Town. Now 2 provinces are allocating resources for you. So the information here will then be able to use to say, wherever province that you are in, or city or town that you're in, we're able to have your medical information. And also, South Africa has a very high rate when it comes to, actually it's about 96% last time I checked, adoption rate for WhatsApp. So when WhatsApp came into the country, everyone adopted. So we want an app similar to WhatsApp that can then, for instance, we've got about, each province has got 1 or 2 tertiary hospitals. Tertiary hospitals are where your high-level specialists are based. So they don't have access to be able to see everyone because they're limited. And 80% of South Africa, which is 50 million people, are all dependent on the public healthcare system. Only 20% is using the private healthcare system, which is very funded than the public healthcare system. So we want an app that is similar to WhatsApp, where when you're supposed to pick up your chronic medication for TB, HIV, it prompts you and says, you've got a due date on this day, this is what, and also share information on there, and also be able to give all the necessary information that you would need as a patient to be able to take care of yourself, which is sort of similar to the lady from the UK who was talking about e-health. So basically, our app has got all those innovative features that we want to implement, specifically looking at the AI. But before we go into the high-level tech, we just wanted to first take care of getting the data and using that data and having other APIs and other information that we can integrate into the system to make sure that we've got technology that comes into it. Thank you so much. That's me. You see, beautiful smile. Thank you so much.